And believe me, this stuff has consequences. The only good news is the liberals are dragged down with all the rest of us. Now, here's the New York Post. Betsy, how do you pronounce her last name? I can never, Macaulay, right? McCaw? Very, very, excuse me, very, very sharp lady, and I apologize. I just haven't seen the name lately. McCoy, I'm sorry, Betsy McCoy. She has done tremendous work in this area of Obamacare. If you get your health insurance through a job, you might lose it. As of January 1, 2014. There's a cliff. We'll call that one the healthcare cliff. That's when the new employer mandate kicks in, requiring employers with 50 or more full-time workers to provide the government-designed health plan or pay a fine. And the government plan is so expensive, it adds $1.79 per hour to the cost of a full-time employee. That's incidental if you're hiring neurosurgeons, but a hefty increase for hiring busboys and sales clerks. Why wasn't this mentioned during the campaign? All right, more. Betsy McCaw. Shoot, what is it? McCoy. Okay, sorry, Betsy McCoy. When you file your taxes, you'll have to show proof that you're enrolled in one-size-fits-all health care plan approved by the federal government starting January 1, 2014. You believe that? You have a federal government-approved health care plan. The day has come. The day has come. It's here. Now, if you've been going without insurance or your employer drops coverage, your options will be enrolling in Medicaid, but you have to be eligible for it, or buying a government-approved health plan on your state health exchange. Now, everybody talks about these exchanges, and nobody knows what they are. And that's part of the problem with communication. What's an exchange? She says it's like a supermarket that only sells cereal. The exchange will sell only the government-designed plan. In most states, exchanges will be an 800 number, a website, and a government office like the DMV. People with household incomes up to $92,000 will be eligible for a subsidy. Why? Why? If you're a senior or a baby boomer, expect less care than in the past. Cuts to future Medicare funding pay for more than half the Obama law. Hospitals, for example, will have $247 billion less to care for the same number of seniors than if the law had not passed. Now, I want you to think about that. $250 billion less to spend on seniors. That's just the hospitals. Not the doctors, not the drugs, the hospitals. What do you think is going to happen? Seniors. Hospitals will spread nurses thinner. California nurses already are striking over the increased workloads. And when Medicare cuts led hospitals to reduce nursing care in the past, elderly patients had a lower chance of surviving their stay, and death rates from heart attacks rose, according to a report last year by the National Bureau of Economic Research. Why wasn't this mentioned during the debate? There was so much low-hanging fruit that just sat there on the tree and rotted away. Well, we don't want to turn off this group or that group. Well, you did. For the first time in history, the federal government will control how doctors treat privately insured patients. Section 1311 of the law empowers the Secretary of Health and Human Services to standardize what doctors do. Even if you have a private plan from Cigna or Aetna and you paid for it yourself, the federal government will have some say over your doctor's decisions with an eye toward reducing healthcare consumption. We call this rationing, like they used to do in the late East Germany. We call it rationing. And I've talked about this, too. If you sell your house and make a profit, congratulations, you're one of the few. But the government, like the mob, is going to tap into you. You'll likely be paying a new 3.8% tax on the gain. The law includes about $500 billion in tax hikes, including a new 3.8% tax on gains from selling any asset, including your home, small business, stocks, or bonds, effective January 1, 2013. Gee whiz, 2013, January 1, that's just a few weeks away. That's on top of capital gains taxes and applies to any profit that pushes your income over $200,000. Well, it only applies to the rich. Really? So the sale of your home, if it pushes your income to over $200,000, only applies to the rich. We're not talking about Vanderbilt here, ladies and gentlemen, or J.D. Rockefeller, or J.P. Morgan. We're talking about you. These changes are spelled out in 2,572-page law, but many more changes will be imposed by regulations yet to be written. And all we did during the campaign on Obamacare is, we're going to repeal it, and replace it, we're going to replace it and repeal it. Why? What's wrong with it? What did Obama do to Grandma? What did Obama do to the autistic kid? You see, it's Obama pushing grandma in the over the cliff. It's Obama who's going to deny care for the autistic kid. That's what Obamacare is. Why didn't they say it? Because they won't. They're incapable of it. Because they're running around today talking about amnesty. They're running around today talking about tax increases. Well, what's another few dollars for a millionaire? We got to change our message. Then change it. But they're not capable of changing it, ladies and gentlemen. Do you want to know why? They don't believe it. They walk around with their dire look on their face, staring at their loafers, walking around on Capitol Hill. Oh, we're only one half of 1/3. And you know what? They're happy. Speaker of the House gets his car, he gets his protection, gets a little kick up in his salary, goes down in history, footnote to a footnote, but nonetheless, there he is, enjoying himself, all these years of work. From the bar, cleaning floors, here I am, Speaker of the House, and I'm not going to risk it. I'm not going to risk it for these right-wing nut Tea Party types. And if the country goes down, well, by God, hopefully it won't be on my watch. And he's not the only one. The sheep are all following him right now as I speak. Unbelievable. They control the whole system on the Republican side, and then they keep lecturing us about how we have to change our message. We have to reach out to this and that. No, we need to change them so we can change our message and save our country. And I don't care if I'm the only voice in America who keeps saying this. You know I'm right. Yeah. That's why I don't go to Republican conventions. I'm not very well liked at these places. I'm not. And you should see the hush-toned emails I get from, you're right, keep it up, you're right, but don't mention me. Okay.